before the website launched. Was it a complete surprise?
So, Jake, I think that the 8.6 million unique visitors in the first 3 days exceeded anybody's expectations, and that level of volume triggered the initial problem with the healthcare.gov website, where what was happening was, given that level of volume, people were actually being sent into waiting rooms and then had to wait before they could cycle through the process. That's built up to 20 million unique visitors, and the good news is 500,000 applications and enrollments throughout the country and in the federal marketplaces.
Well, David, you're not still saying that it's just a volume question, right? I mean, there are lots of individuals saying that there are serious software issues, that the beta testing didn't happen, that there wasn't enough time to practice before the website was actually launched. You're not actually still saying this is just a question of volume.
So, Jake, what I said was the initial problem that we faced
Okay, so
was driven by volume.
So what are we facing now?
So what we're doing, well, here's what we know. Folks are going through and they are applying. Not enough folks are going through and applying. Too many people are being held up. We've got a tech surge throughout the process right now to determine where there are bugs, where there are glitches, to identify them, to isolate them, and to fix them. So between hardware and the tech folks coming in, we feel that while it's been a bumpy 3 weeks, we've got the resources on the ground now to make sure that, as the president said today, anybody who wants to go to healthcare.gov can go through beginning to end and have a good consumer experience. That's what we're building to.
December 15th is the date you need to be signed up if you want to have insurance starting on January 1st. March is the date you need to have been signed up, gotten insurance if you don't want to pay the penalty. Can you promise that the website will be fully functioning by either of those dates, December 15th or the March 2014 date?
So, Jake, besides the improvements in the website that are going to continue throughout October into November, an important thing also to remember is that there are multiple pathways for folks that didn't exist before. The president mentioned one today in terms of the 1-800-318-2596 number. There's a new tool on the website that allows you to find out where the local assisters and navigators are in your community, and for those individuals who simply want to download the 3-page application, not 35 pages, as was the industry standard, they can do that. So besides an improving website, a 1-800 number that people will have access to, folks on the ground who will meet the demand, and the ability for people to do it on their own, we'll be ready.
Right, and we obviously want people to get health insurance, and we obviously want people to be able to do that so they don't have to pay the fine, which is why I let you do what President Obama did earlier and give the public service announcement about other ways. But you didn't answer my question. Will the website be up and running? Can you promise by December 15th or by the March deadline, either one of those dates? Yes or no? Can you promise?
So, Jake, yes, between the website and all of the other ways that people have to sign up.
Well, that wasn't really the question.
Well, but here's the reality. Any American over the course of the next 6 months who either doesn't have insurance or is on the individual market, between a website service that prior to October 1st didn't exist, a 1-800 number prior to October 1st that didn't exist, navigators, and the ability to do it on their own, they can get insurance.